Conventional IVF procedure, a step-by-step guide. Semen quality is the key point while deciding to do CIVF or ICSI. After preparation of the semen sample via density gradient technique, sperm concentration with progressive motility is defined. Note that the progressive motile sperm concentration to be used for insemination has to be sufficient enough for normal fertilization. In Gelecek IVF Center, a cutoff index value of 100,000 is defined for progressive sperm cells with normal morphology. Hence, we prefer CIVF for couples with an index value of greater than 1000. ICSI is the choice of insemination for patients with a history of fertilization failure, even if the semen index value is above cutoff value. Sufficient number of 4 well-cultured dishes are prepared the day before oocyte retrieval. Each well is filled with 0.5 milliliters of fertilization medium. Afterwards, each well is covered with a layer of 0.3 to 0.4 milliliters of mineral oil. One 4-well dish will be sufficient for every 10 cumulus oocyte complexes. In our practice, we place 3 cumulus oocyte complexes into the first 2 wells, and 4 cumulus oocyte complexes into the third one. The 4th well is used for washing. Calculating the amount of sperm used in IVF. 1 milliliter equals 1000 microliters. In our calculation, we'll be using 100,000 sperm cells per cumulus oocyte complex. The amount of progressive motile sperm in 1000 microliters is known. However, at what volume can we obtain 100,000 progressive motile sperm cells? For this calculation, we'll be using a simple mathematical formula. In this formula, volume equals 100,000 multiplied by 1000 over progressive motile sperm quantity. As an example, let's assume there are 20 million progressive motile sperm cells in 1000 microliters. What is the volume required for 100,000 progressive sperm cells? According to the formula, the required volume is 5 microliters. It is noteworthy that the cumulative oocyte complexes do not undergo denudation process prior to conventional IVF. Hence, they are inseminated with the sperm suspension directly, without subjecting them to hyaluronidase. After egg retrieval, cumulus cells are partially dissected by a needle tip and washed in buffered solution. The volume of sperm suspension to be used for insemination is determined, given that 100,000 sperm cells will be used per cumulus oocyte complex. Since the first 2 wells contain 3 cumulus oocyte complexes each, 15 microliters of sperm suspension will be added to the first 2 wells, while 20 microliters of sperm suspension will be added to the third well. Using a manually adjustable pipette, the required amount of sperm suspension for insemination is released onto the oocytes and placed in an incubator. Insemination time, the initials of the embryologist, and the progressive motile sperm concentration is recorded in patient files. Fertilization is checked 18 hours after insemination.